Good afternoon. Welcome to the Wisconsin Health News Legislator Roundtable. Thank you all for tuning in. My name is Tim Stum. I'm the editor of Wisconsin Health News. We have a great lineup of panelists with us today. Joining us are Senator John Erpenbach, Representative Joe Sanfelippo, Senator Patrick Testin, and Representative Sara Rodriguez. Thanks to all of our panelists for taking some time out of their busy schedule today. It's a busy day at the Capitol today. And thanks to our great sponsors for making today's Newsmaker event possible. A huge thank you to Anthem Blue Cross and Blue Shield, Deloitte, Froedtert and the Medical College of Wisconsin, Husch Blackwell, von Briesen Roper, and the Wisconsin Hospital Association. Thank you also to Badger Bay Management for helping host our virtual events in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can sign up on our website at wisconsinhealthnews.com or through the event evaluation form, which we'll email out after today's event. An extra thanks today to Deloitte, today's featured sponsor. We are very grateful for all of their support. Here to say a few words from Deloitte is Hannah Kampke.
Thank you, Tim. So for those I haven't yet had the pleasure of meeting, my name is Hannah Kampke, and I'm a senior manager at Deloitte out of our Madison office. Deloitte's actually been a proud sponsor of Wisconsin Health News for many years, and we certainly appreciate the opportunity to engage with all of you today on what's happening around healthcare and health policy in Wisconsin. I'd also like to take a moment to acknowledge and thank all of the healthcare leaders on this call for everything you've done to help us to get through the COVID-19 pandemic. Deloitte's very proud to work alongside all of you to harness the skills and resources of our organization and help meet the challenges of this public health emergency. To share a little bit about Deloitte, our Madison office is actually home to 250 professionals who support the state of Wisconsin and help them with their programs that benefit millions of Wisconsin residents. Our work ranges from everything from health and human services to workforce development and cyber risk and higher education. And we're very, very proud to be able to help not only the families in Wisconsin, but also our community to thrive and to overcome this pandemic, especially with the trying times we've had. So we're very excited to hear from our legislators, our legislative panel today, who are obviously responsible for setting the healthcare priorities for the state and funding programs to help all of Wisconsin recover from the pandemic and prepare us for a brighter future. And we're very hopeful that once we get through this, we'll be able to do events like this in person again in the near future. So with that, I'll turn it back over to Tim.
Well, thank you so much, Hannah, and thanks again to Deloitte for all of your generous support of Wisconsin Health News. Thanks again to our legislators for being here today. It's been a busy start to the session so far. Just to briefly recap the past couple days, on Thursday, the legislature voted to strike down Governor Evers' public health emergency and thus end the statewide mask mandate in the state. Governor Evers promptly then issued another public health emergency. On Friday, the legislature sent a revised COVID-19 relief bill to the governor with additions from the assembly. The governor vetoed that bill. Meanwhile, the governor is set to virtually deliver his budget address on February 16th, and committee hearings are starting to ramp up in the Capitol. So a lot going on. We'll hope to discuss a lot of it in the next hour. A couple programming notes today. We do have some moving pieces to today's program. Senator Testin is hosting a health committee hearing this afternoon at 1, so does need to duck out a little bit early. And Representative Sanfelippo is actually in the middle of a caucus meeting as we speak, so he's going to leave that and join us for part of today's program. So it's going to be a true test of our virtual capabilities here today. We're going to have to shift around a little bit more than we normally do, but I think it's going to all work out great, and we're looking forward to a great discussion. So Senator Testin, I want to start with you. There's a full slate of bills on the docket for today's health committee hearing. Overall, what are your top health priorities this session? What are you most focused on getting to the governor's desk?
Yeah, I think, well, first off, it's really great to be back and have the opportunity to chair the health committee again for this session. As you referenced, we are going to have a public health hearing committee at 1, and we've got a number of pieces of legislation that are up dealing with providing more funds for community health centers, which provide a lot of critical care, especially in underserved areas. Legislation that's going to deal with creating a database for opioid and methamphetamine drug-related cases. So we have a better idea of all the programs that we've done over the last several years to identify what works, what doesn't, what needs improvement. And overall, big picture, one area that I'm really going to focus on through the health committee this session is the work that was unfinished as it relates to clean water. So last session, we had the Speaker's Task Force on Water Quality, in which I had approached Speaker Voss to include the Senate with an issue as big and important as this, that it was critical that we work in a bicameral fashion to address these issues. And so we spent months traveling the state to hear some of these issues. Unfortunately, a lot of those bills didn't come up on our last session date because of COVID-19, but we want to get that work started back up again and hopefully get those bills at the governor's desk, because they were good bipartisan bills that were consensus bills that we think are good policy, and more importantly, provide for better health outcomes for the people of the state.
Great, thanks, Senator. Speaking of COVID-19, the governor vetoed the COVID-19 relief bill that was sent to him last week. What's the future of that proposal? He said he would have signed a version that the Senate passed. Is there an appetite in the Senate to try again and get something similar to him?
There are certainly those possibilities. We haven't had those discussions yet within caucus. I will say this, I was a little disappointed. Initially, we had negotiated our leadership with the governor on a pared back version of AB1 that was sent over to us. In the back and forth between both houses, there were some provisions that were tacked on that I guess the governor felt were a bit too much and gave him a little too much heartburn. But in the grand scheme of things, a lot of what was in that bill, I think 80% of what was in there probably could have got agreement on in bipartisan support. Things like extensions within Act 185, an additional $100 million set aside for COVID relief here at the state, and a whole host of other provisions that we thought were pretty common sense. But those conversations will continue, and hopefully we can get something to his desk sooner rather than later.
So a couple of those provisions, your committee is actually taking up as standalone bills this afternoon. Proposals that would allow dentists and pharmacy students to administer COVID-19 vaccines. Is that a signal that maybe the plan might be to, instead of one big bill, deal with parts of this through separate proposals?
I think that's going to be one strategy that you see moving forward. And that was one provision that I was very supportive of within AB1, was trying to get more people in the pipeline to administer vaccinations. And with the initial rollout here at the state, we kind of lagged behind other states. I'm happy to report that we seem to be getting back on a better trajectory as it relates to our COVID vaccine rollout, which is great. More people that we can get vaccinated who want to be vaccinated, the sooner we can get back to some sense of normalcy.
Great. So I want to shift a little bit to some of the budget proposals that the governor has unveiled so far, including today's announcement that the governor wants to invest more than $600 million in long-term care through a number of proposals based on recommendations from the governor's task force on caregiving. This package includes proposals that you've been behind, including a tax credit for caregivers and creating requirements and standards relating to caregivers for hospitals discharging patients. Overall, is this a package that you support? Do you think this is the budget is the right place for something like this?
I mean, there are going to be some provisions within that I think, again, you're going to find bipartisan support that either within the budget or standalone legislation that we hope to accomplish. But that's going to be the arduous task of the Joint Finance Committee over the course of the next several months. After the governor introduces his budget, they will begin the process of putting a budget that, one, make sure that our fiscal house remains in order and we prioritize what needs to be prioritized here in the state. So that's going to be an ongoing discussion between the Joint Finance Committee and between both houses.
Okay, so another proposal that he has so far unveiled is one calling for the legalization of recreational marijuana in the budget. You have been a proponent of medical marijuana, concept that Speaker Voss also supports. Given the new leadership in the Senate, do you think there might now be a path towards something on medical marijuana to get through your chamber?
I think it would still be difficult, but I still think that's a conversation that has to be had, providing patients that type of medical freedom and choice. And I had a great time working with Senator Erpenbach last session on our bipartisan bill that we spent countless hours between ourselves and our staff to get us to a point where we felt comfortable with the legislation. Now, granted, it didn't go anywhere, but as I've said before, we have to continue to educate and advocate for these policy positions, and I intend to do so. And extend the invitation again to work with Senator Erpenbach, if he's willing to do so this session, to hopefully reintroduce another medical cannabis bill.
So Senator Erpenbach, I want to move to you then on that same topic. You've partnered with Senator Testin on this. One thing though that one group that has not yet largely embraced a move towards medical marijuana is overall the medical community in Wisconsin. How does that impact your support for the proposals? Is this still something that you are behind? Do you think maybe recreational marijuana, as proposed by the governor, is the better route? Talk about your stance on medical marijuana with the overall maybe not great support with the medical community right now.
All right, thanks, Tim. Good to see you again. So here's the deal with medical marijuana and recreational marijuana. Wisconsin's quickly becoming an island with Illinois and Michigan going full recreational. I believe Minnesota is medical. But the legislature's always kind of been behind the curve on this particular issue, especially medical marijuana, when it comes to what the rest of the state thinks. And the rest of the state does support overall recreational marijuana. And so the idea that the governor is just proposing probably where we're going to end up someday, sooner than later, will be full recreational marijuana use in Wisconsin. But the idea is, to put limitations on it, to tax it, and to take that taxable revenue if you're using it recreationally and spread it out to places that need it. So I think what the governor is proposing is something that the majority of Wisconsinites do favor, but certainly the majority of legislators don't favor right now. But again, it's not the first time on an issue where the legislature's been behind the curve on it as far as what people think.
Senator, briefly, what are other priorities, health priorities of Senate Democrats this session?
Well, obviously, COVID-19 continues to be, the top priority in trying to deal with this issue as best as we possibly can. I know the state's improved on the vaccine rollout, and I think we're now number one in the Midwest per capita when it comes to making sure that Wisconsinites are vaccinated, but also trying to get schools reopened safely as we possibly can, helping small businesses as best as we possibly can. This has been very, very difficult on all of Wisconsin. Whether you're a business owner, whether you're a parent who had to give up a job or keep your job, work from home, as well as making sure that your kids are sitting in front of a computer as best as they can and dealing with their issues at school. So COVID-19 and still trying to get a handle on this remains a top priority. Not sending mixed messages out of the legislature should be a top priority. The lawsuits stopping should be a priority. Other than that, Medicaid expansion continues to be an issue that we all need to try and deal with as best as we can. It's not a welfare handout anymore. Medicaid expansion will leverage hundreds of millions of dollars for Wisconsin, money that belongs rightfully to us that we certainly could use right about now, and making sure that people have access to good quality, low cost healthcare as best as we can. So those are the priorities, I think, for the Senate Democrats as a whole when it comes to this upcoming session.
Great, thank you, Senator. So I want to come back to you on several of those topics. And I want to move on to Representative Sanfelippo now, though, who has joined us. Representative Sanfelippo, thank you for being here. We'd, of course, love a brief breakdown of all the highlights you've discussed so far today in your caucus meeting. If you can't do that, I want to shift a little bit about and talk about the COVID-19 relief bill that we just talked to Senator Testin a little bit about. It was vetoed by the governor last week. The governor said that he would sign a version of the bill that had been passed by the Senate. Is this something that the Assembly is willing to go back and rework? What's the future for this COVID-19 relief bill?
Well, it doesn't surprise me that the governor wants that bill because he's getting, everything he wants without the protections that I think are important that we're hearing from our constituents that we need. So there's a lot of things in the Assembly bill that were good items that should have been included in there right from the start. I don't know that trying to take them all out helps any purpose, because then we're really not accomplishing what we need to as legislators. I think the governor has to recognize that, when you have a compromise bill, it takes two sides to compromise. It can't be the governor insisting that the legislature do all the compromising and he gets everything he wants. And so until he realizes that, we're going to be at a standstill, I think, with a lot of the good things that are included in AB1 that should be getting done.
So it's out. Are you saying there's not a lot of appetite in the assembly to pass what was passed in the Senate, at least part of that COVID relief bill, or is that not?
Well, I'm not going to sit here and speak on behalf of the entire assembly because I'm not even in leadership, but I'm speaking on my behalf and telling you exactly what I feel. There's too many things, important things in AB1 that need to be included in the bill. So to the extent that the governor is willing to sit down and talk about, getting the schools back open, not allowing churches to be shut down so that people cannot worship, and some of those important things, the visits in the nursing homes for the family members and in hospitals every day, almost, I hear complaints from constituents who, have loved ones in very serious conditions and some of them dying in hospitals, and they're not allowed to go see them, which is utterly ridiculous. And so those are the types of things that need to be addressed. Before we can have any movement on that bill, I think we're going to have to see more of that happen.
Senator Testin's Health Committee today is taking up a couple of the proposals as individual bills that would specifically allow dentists and pharmacy students to administer vaccines. Would you be in support of other standalone bills from that larger COVID relief package?
I think that everything that was in that original bill really works smoothly as part of one bill. So to start cherry picking or start pulling things out that the governor already said he's opposed to is just a sure way to see those things die. So to that extent, no, I don't think they should be pulled out.
Okay, so I want to shift gears a little bit now to the topic of masks, as there's been a lot of back and forth on this in recent weeks, and this was far and away the majority of the audience questions that we received were focused on. And I think these audience questions can best be summed up with one word, and that's why. Why did Republican leaders, including yourself, vote to end the public health emergency and thus end the mask mandate? And why now, more than 6 months after the mask mandate first went into place, and not until the governor's fifth public health emergency was about to expire? Why now was that vote taken to approve that resolution to strike down the emergency?
I think the answer basically comes down to our simple understanding of we are a country and we survive by the rule of law. And you have a governor, regardless of what you think about masks, and I agree masks should be worn and there's a place for them. But we have a governor who is abusing the statutory authority in declaring these emergencies over and over again, rather than following the statutes and working through the process to put this in. An emergency, if you look at the definition, an emergency is defined as something that comes up suddenly and needs immediate attention. So while we may still have a crisis with COVID, the emergency is long gone. We've known about this for a year. It's been here for a year. So to continue to abuse that authority is wrong. And I think that, if we don't stop it, where does it end? I mean, can you imagine the Department of Revenue all of a sudden saying, gee, we're going to raise sales tax 8% to 8% because we need more money for COVID? You just don't do that things. You follow the legislative process. And had the governor have done that, in fact, we sent him a letter inviting him and asking him to do that, follow the regular process, and he hasn't done it. We've had over 300 emergency orders issued since the statutes were enacted. We've never had a crisis like this before, and that's because all other prior governors, including Governor Doyle, who's the only other governor to issue a health emergency, followed the statutes, and after 60 days, either repealed them or work through the normal rule process. For some reason, Governor Evers feels that he doesn't have to follow the law.
So why now, though, Representative? This is the governor's fifth public health emergency when this resolution was approved. Why not do it when he issued the third or the fourth public health emergency?
I think at that time, there were still a lot of unknowns about the COVID yet that we were learning. We have almost 12 months worth of data and statistics underneath our belt. We see that people are following CDC guidelines. I mean, do you really think people are wearing a mask only because Governor Evers told them? I think that people are wearing a mask because they think it's the best thing to do for their own health. And so I trust that people are going to make smart decisions for their health. and we should leave those decisions up to them. But that being said, masks are important. If we want to mandate them and have requirements in certain settings under certain conditions, I'm all for considering that. But the fact is, we have to do it through the lawful process, and we haven't done that so far. The governor hasn't done that so far.
Do you expect that Republicans will take action to strike down the governor's new public health emergency, or at this point just wait until the Supreme Court rules on this?
I don't know. Again, I'm not in leadership, so I can't say what what the thinking is. The actions, originated on the Senate side, not on the Assembly side. So I can imagine that if anything happens, it's going to probably follow the same course.
Okay, so a major implication of the public health emergency ending was that the mask mandate ended along with it. And it's because of that implication that nearly 60 groups registered in opposition to the resolution, including every major health group in the state. So you are the chair of the Assembly Health Committee. Did you consult with any health groups before striking down this public health emergency? Are there any healthcare groups that you can name that support this action to strike down this public health emergency?
Look, obviously, I'm in contact with every major health organization on a weekly, if not daily basis, talking to them all along. Okay, but we can't let the end justify the means. If we're going to let a governor go rogue and ignore the legislature, you have basically a constitutional crisis here, right? Our Constitution lays out a process. I mean, there's still 50,000 people that had voted for us, or 50,000 people we represent in the Assembly. The Senate districts are even bigger. The governor's completely cutting all of those people out, and we're more accessible than he is to the general public, but he's completely cutting all of them out by insisting on following this illegal route. And it's especially stupefying when, if he really honestly in his heart feels that this mandate is so important, why is he taking the highly political route of doing it this way rather than working through the rules process? It is very simple. He's got two paths to legally do this under statutes. He's ignoring both of those legal paths and taking the one that is drawing the most ire. And he's doing that purposely, and he's done it time and time again. That I just think he just wants this to be more of a political issue than something that he's really looking out for the public good.
And so one more question. I do want to switch topics, and I will get to the other panelists on this topic, but I know you have to. I
hope so. They're probably tired of listening to me.
I just one more on this. So if the governor did go through the rules process, or this was gone through the legislative process, is it something that you would support to have a statewide mask mandate?
Not statewide. I think that we need to take a look and put it in proper settings, right? It's easy to just say, "I'll throw it on statewide and be done with it," and act like we're doing something. We need to roll up our sleeves and do the hard work, analyze the data, determine where they are called for and where they're not called for, and put them in place accordingly.
Okay, so I want to move topics, and I will get on to the other panelists about this topic, but Representative Sanfelippo, why we have you. I want to talk about vaccines. You've been pretty critical of the state's rollout of this process. You've authored a bill that would require, among other things, that the state open vaccines to all adults by mid-March. Can you just briefly explain to us why you think this legislation is needed?
Well, this thing was mired down in such a ridiculous bureaucratic process that it was taking forever for them to decide who was going to get beyond Group 1A. We knew who 1A was. That's going to be the frontline healthcare workers. But while most states are into 1B and into Group 1C or beyond, our subcommittee here, created by the governor, is still arguing on who's good enough to be considered in Group 1B. And we can't see the forest through the trees on this issue. We know that if you just look at an age group, 60 and above, they represent 66% of the COVID-related hospitalizations and 92% of the COVID deaths. So why are we worried about where somebody works, where they live, who they are, what race, religion, whatever? Let's look at vaccinating the people who have the greatest risk of fatality and just do it that way. It doesn't matter that somebody, where they live, for example. I mean, why should a healthy 25-year-old who has less than 0.5% of having a fatal reaction from COVID
get vaccinated long before somebody who's 64 years old and is over 15% susceptible to a fatality. It just makes no sense whatsoever. But this is what happens when you get all these bureaucrats involved. And then the other thing they're arguing over is how do you get it distributed? And you can see finally in the last 10 days, we've made more progress than we did in the whole 2 months that we've had the vaccine. And that's because we're shining some light on the complete ineptness of this administration to roll these vaccines out. They kept blaming it on the federal government that it's a supply problem. There was no supply problem. It was a distribution problem at the state level that was screwing everything up. We weren't getting the vaccines out as fast as we were getting them from the federal government.
But right now, Representative, the state is averaging about 80,000 doses a week, which is an increase from previous weeks when it was 70,000 a week. There's over 4 million adults in the state. I mean, you have to admit it's at least part a supply issue. There certainly aren't enough vaccine right now to meet the demand that we have for this.
But aside from the supply, okay, we went from being dead last, just about, I think we were 49 out of 51 states and the District of Columbia as far as actual administration. And in 10 days, we went from that miserable number all the way up to within the top 10. Well, we didn't all of a sudden get a massive flow of new vaccines from the federal government. We just started getting the vaccines we already had into the arms of people. So that shows that this whole finger pointing exercise at the federal government was just a smokescreen to cover up for their own ineptness.
Representative, what are your other health priorities this session as the chair of the Assembly Health Committee?
We're going to just keep working towards increasing affordability and accessibility. So we had the PBM bill from last session. We had pre-existing bills from last session, things like that we're going to focus on. And we're going to keep our eye on this vaccine rollout to make sure that it continues to go in the right direction and we don't allow them to bungle it up any further.
Great. And then one final question, and then we're going to move on. Most of the state right now, and this is especially true for healthcare groups, would love to see a better relationship between the governor and the legislature. What steps do you think could be taken to improve this relationship?
It takes two to tango. I'm willing to work with anybody. I think, if you look at the history of our own committee, for example, the Health Committee in the Assembly, we have a great history and relationship of working together across the aisle when Rep. Kolste was the ranking minority member. And, I look forward to that continuing on our committee, and I'd love to see it go between the entire legislature and the governor. But it takes two to tango. And when you have one side that's willing to sit down and talk and negotiate and another side that just draws a line in the sand and says it's my way or the highway, it's very difficult. And that's what we've seen out of the executive branch so far.
Okay, Representative, thank you so much. It was good seeing you. We appreciate the time. Representative Rodriguez, I want to, we've not forgotten about you. I want to switch to you now. I want to get back to just briefly get back to the mask discussion. To Representative Sanfelippo's point, we're almost a year into the pandemic now. I think that you can safely say that most people have made up their mind on whether they're going to wear a mask or not. Many of the population centers in the state have issued their own mask mandate, and it's likely that more communities would do the same if the mandate went away. And those that won't, it's often not being enforced anyway. This is kind of a long-winded way of asking, what impact would this really have if the statewide mask mandate went away?
So I do think it's going to have a significant impact. I'm a registered nurse. I have worked a long time within public health. I was an epidemic intelligence service officer with the Centers for Disease Control, did national and international outbreak investigations. And we just have very few tools in our toolbox to be able to manage this pandemic. And right now we're in a race between the new variants that are more contagious and being able to get those vaccines in arms. And masks are one of the only ways that we can make sure that we can curb the spread of COVID and keep our schools open, keep our teachers safe, keep our grocery workers safe, and our healthcare providers safe as we move forward. And so the concern I have by not having this statewide mask mandate is that additional people will choose not to wear masks within different organizations and businesses, or businesses will decide that they are no longer going to require masks within their businesses, and it will affect the health and safety of their employees. I, as an individual, can choose not to go into a store if they are not wearing masks in that store. But there are employees there that need to put food on their tables, and they may not have that choice. And so I was really happy to hear Representative Sanfelippo tell me that he is absolutely willing to consider legislation for a statewide mask mandate, because that's a bill that I just authored that would actually tie the statewide mask mandate to the federal emergency. And so that if this is not about masks, which I do believe it is about masks and getting rid of the statewide mask mandate, then that is legislation that we should take up as the Assembly and actually put that forward.
Do you think, absent legislation, do you think that the governor has the legal authority to issue these successive public health emergencies?
Yes, I mean, he has actually, one of the Republican senators actually indicated that in his reading of the law, that he did not see that the governor was unable to issue these successive public health emergencies. And that is a question for the Wisconsin Supreme Court right now. If this was cut and dry, as Representative Sanfelippo has been indicating, then we wouldn't have a question before the Supreme Court. So, I think as we move forward, if we should be following the public health emergency for the governor, and we should be following those public health practices that we know curb the spread of COVID-19.
Thank you. Senator Erpenbach, what do you think about that? Do you think that the governor has the legal authority to do this? And what do you think the impact would be if the mask mandate went away?
I'm not a lawyer, so I'm not certain he does or doesn't. I don't know, but I do know the pandemic's not going to take a time out while the legislature gets its crap together and go through the rulemaking process to decide whether or not we should or should not be wearing masks. We listen to scientists. We listen to the medical professionals. This is what they're telling us to do. And as a result, you just take a look at Dane County. Dane County's numbers are much better because they were tougher on the mask mandate and they were tougher on the public gatherings and so on than pretty much the rest of the state. The masks work. You can't deny that. And if, as Sara said, if it's not about the mask, we introduced a piece of legislation the very next day on the mask mandate, making it statewide, tying it to what the feds were doing. And not one single Republican has signed on to it yet. So it really is about the masks as far as I'm concerned. So if the speaker or Joe gets upset about the fact that maybe Tony did something he shouldn't have done, well, then what are you proposing to do? They've gone to court, they've voted things down, but they haven't offered up really any solid alternatives to try and keep Wisconsinites safe. We do know masks work. We know that. So the idea that the governor had to do what he had to do because the Republicans in the legislature wouldn't do anything for well over 200 days on this issue, nothing. And the only thing they've done on COVID-19 has been vetoed after there was an agreement with Senate Republicans in the governor's office. So the idea that masks don't work and it should be up to the individual, they do work. They absolutely do work. And if you don't want to wear a mask, then don't go outside. If you don't want to wear a mask and you think it's your God-given right not to wear a mask, then don't get the vaccine. Don't cut in line in front of somebody else and take their vaccine away from them. So needless to say, a lot of passion about this particular issue, but masks work. And if the legislature is not going to meet and work with the governor on this issue, the governor has to issue an emergency order to keep Wisconsinites safe. There's no way around it.
Thanks. Senator Testin, let's get to you on this issue. You joined most of your Senate Republican colleagues in voting to strike down the public health emergency and thus end the mask mandate. Would you support doing this through the legislative process? Are you in support of a statewide mask mandate if it was done through the rules process or through the bill unveiled by Democrats?
Yeah, I personally, I don't think we need a statewide mask mandate. I put the trust of the people of the state to look out for their own health and interest, and trust employers as well as employees within the various businesses to take extra precautions, to wear masks when they're indoors in business, when social distancing can't be adhered to. So I don't necessarily see this as a role of government, but I know that's a point of contention between ourselves and the administration as well as some of our colleagues here on this panel. But overall, I do believe this is a question that will have to be settled by the Wisconsin Supreme Court with the Froedtert case. And I believe one of the reasons why we haven't seen any action taken to date is because in the legislature, we hadn't exhausted all of our options yet. And so by coming in to remove the emergency order, we have now exhausted all that, Clearly, the governor issued one shortly after the order was shot down. So this is really going to be a case that the Supreme Court's going to have to answer, because as Representative Sanfelippo mentioned earlier, as far as I can tell, and again, I'm not an attorney or profess to be one, but from the statutes under 323, it's laid out explicitly clear that the governor has 60 days to declare an emergency, and then after that has to come before the legislature to get an extension.
So, Senator Testin, you are the chair of the Senate Health Committee. Have you consulted with any health groups who back your opinion that masks are not something that should be mandated?
No, we've had lots of conversations. I mean, conversations with WHA and other organizations, but this really isn't about the masks. This is really about the rule of law, and that the rule of law.
Specifically about the mask mandate, like supporting the bill that Democrats put forth, or going through the rules process on the mask mandate.
Yeah, I don't believe we need a one-size-fits-all approach. I have the utmost faith and trust in the people of Wisconsin to take the precautions they need to make sure that they're looking out for their health.
So we're required to wear seatbelts, as the argument that's made against this is that we're required to wear seatbelts. How is that different from requiring masks in a public health emergency?
Yeah, I've heard this argument quite a bit. I mean, we're comparing apples to oranges, but again, it's at what point do we stop? What's the end game? When does this expire? I mean, when do the masks go away? I mean, again, we can debate this issue night and day, but let's leave it up to individuals. We have the CDC guidelines out there. We have the recommendations that came up from WEDC shortly after the Supreme Court case back in May that provided guidelines or recommendations for specific industries and businesses to operate safely. And so we should leave it up to individuals.
So shifting topics a little bit, Senator Erpenbach mentioned something that the governor will likely propose in his budget, and that's again to expand Medicaid. While overall the revenue picture is better than expected, healthcare providers are still reeling from the financial hit they took from responding to COVID-19 pandemic. Will that cause some Republicans, cause you to rethink previous opposition to Medicaid expansion, or do you think that is something that again will not be supported by most Republicans in the budget process this year?
Well, I can't speak for all of my colleagues in the Senate Republican caucus, but I can tell you from my perspective, after we researched this extensively last budget cycle, that I just don't see this as being a necessary winner for the state. When you take a look at every other state that has taken Medicaid expansion, it has actually ended up leading states to raise taxes and fees on medical providers. And when you take a look at the population that the governor's trying to target, if he does go down the same route as he did last session to go after about those 84,000 individuals that would qualify for Medicaid if we go up to the 137% FPL, roughly half those individuals already have private insurance. And when Medicaid reimbursements are as low as they have that cost shift and put more people on the government-run healthcare. I think it's going to put a greater strain on our system.
What other changes to Medicaid would you support?
One area that we're looking at right now that I think would be beneficial is to have a better report on the Medicaid population as it relates to vaccinations. Currently, 1 in 5 Wisconsinites are on Medicaid, and it would be really great to see just the comparison on how we're doing in the Medicaid department compared to private insurance. Another area that I think we need to be proactive on is, given the aging population of our state, we are going to see a boom of individuals utilize this program moving forward. And in key areas of the state, in places like northern, central, and western Wisconsin, that could put undue strain onto healthcare systems that are already having difficulties finding providers, practitioners to come in. So that's something I think we should be looking at on the proactive end with the Medicaid program to make sure we're addressing the aging population of the state.
So you mentioned earlier today that in the program that you are looking at some of the bills that were passed last session but did not make it through as the COVID-19 pandemic started to spread and the session was ended. Can you talk more about some of those bills that might come back this session, and start specifically with oral health priorities? Are there certain oral health stuff that Senate Republicans are focused on? For example, dental therapy. Do you think that's something that might come back up?
Dental therapy is certainly a possibility. We had, I thought, a very good public hearing last session on that. Obviously, groups were kind of worlds apart as far as whether it's a good thing or a bad thing for the state. And if I remember right, Senator Erpenbach had a comment in that committee that I thought was really appropriate, where it's likely going to come at some point, and we should be preparing ourselves to have other providers come in within the oral healthcare team. One bill that we are going to reintroduce is the Marquette School of Dentistry. This was a legislation that we had authored to entice dentists to go practice in rural areas. Unfortunately, over half of Wisconsin counties continue to be dental deserts. And when the number one reason why kids miss school is because of toothaches, that's a problem. So things like that entice providers to go into underserved areas is going to continue to be a priority for myself and within my capacity as chair of the health committee.
So you are, Senator, the most rural lawmaker on today's panel. What other rural health issues are you looking at?
Yeah, I think another issue that unfortunately this was vetoed in the last budget was providing more beds for mental health. This is a huge issue in rural areas of the state where when individuals are having a mental health crisis, the lack of beds is a real problem, not only for the individual that's in the middle of this health crisis, but also for law enforcement and for our emergency departments in many critical care hospitals that are already under strain. And so we do expect to see legislation to increase beds. And then we've also been having discussions with, in fact, yesterday I was in Sara County, met with some stakeholders on potentially looking at legislation to create a mental health power of attorney. So when those individuals know that they may be in the throes of a mental health crisis, that a mental health POA could help step in and provide health care and care for that individual.
Excellent. What, as I asked Representative Sanfelippo, what steps do you think could be taken to help improve the relationship between the governor and the legislature?
It's certainly a two-way street, and I've been very open about this. The relationship between the Evers administration and the legislature didn't start off on the best of feet with the extraordinary session back in 2018. However, moving forward, we have to understand that we're not going to get 100% of what we want. The governor is not going to get 100% of what he wants. And so there are going to be moments of compromise, but there are going to be times where we're going to be pretty far apart on various issues. But I think if we can focus on finding the common ground first and build upon that, we are going to yield much better results as opposed to just knock down, drag out fights that we've had in recent months.
Great. Thank you, Senator. I want to go back to Representative Rodriguez. Representative Rodriguez, what overall, we talked to Senator Erpenbach about the Assembly, Senate Democrat priorities. What are our health priorities for Assembly Democrats?
You know, I think I think we've already discussed some of them in terms of those health priorities. COVID legislation is absolutely top of the list. This is a once in a century crisis. This is a once in a century pandemic, and the citizens and the people of Wisconsin expect us to do more in terms of being able to help us weather this. Secondly, you know, we did talk about bringing dollars back to Wisconsin, and I think that's what's really important about the expansion of Badger Care for Wisconsin, is that if we can really meet those federal guidelines, there are millions of dollars coming back to our budget that we can put into additional priorities, like Senator Testin had discussed. You know, I worked for a long time for a large healthcare system. I worked in population health management, and I can tell you that mental health services are difficult to come by, particularly for children. And so if we can get more dollars within the state of Wisconsin, there's many things that we could do to help with the healthcare and mental health of individuals within Wisconsin, and, you know, just make Wisconsin a model for how we can manage healthcare.
What are some of the specific steps do you think could still be taken by the legislature to address the COVID-19 pandemic?
So we have some of that legislation that's already there. The compromise bill that the governor and the Senate came up with together, you know, it's not just what the governor wanted. There were things in there that the governor did not want, but they compromised together. And I think honoring that compromise would be important as we move forward, particularly when we talk about improving that relationship between the governor and the legislature. If that's not possible, some of these, perhaps some of these individual bills we could move, you know, put forward. Sorry, I got muted there for a second. You know, the mask mandate that we had put together, Senator Erpenbach and myself had authored, you know, to be able to tie that to the federal health emergency. other things that we can do to expand the access for vaccinations within the state of Wisconsin, and other of those things that we had agreed upon earlier within the pandemic that we can now extend as we move forward to be able to help everyday folks within Wisconsin that we know have lost their jobs or lost their livelihoods through no fault of their own, but actually because of the pandemic.
What about specifically the vaccine rollout process? Representative Sanfelippo has been pretty critical of the state's efforts so far, as have others. Wisconsin recently has made some ground in terms of its percent of doses that have been administered, but as recently as a couple weeks ago, Wisconsin really was at the bottom of the pack in terms of the percent of doses that have been administered. What steps do you think could be taken to help improve the process of getting vaccines out right now?
So I think those steps have already been taken. The governor has already put dollars into having a statewide sign up so that individuals can know where to go. And when they're on the list, when they're ready to be able to be vaccinated, I think that's going to be something that's going to help us within the state of Wisconsin to become more organized within who can get the vaccine and when. So all of those things have already been happening. What we don't need is an additional layer of bureaucracy, which is what Representative Sanfelippo's bill did. It actually put another layer within the assembly of bureaucracy to get that vaccine out. And that's not what we need. So we want to make sure that we give the tools to public health who have done this before. You know, when I worked in public health, I ran the H1N1 mass vaccination within my local public health department in the state of Colorado. And we worked hand in hand with the federal government and hand in hand with the state to be able to have that smooth rollout. So I'm really excited for the Biden administration to come in, to put dollars into this effort to help the states move forward with that vaccination effort and be able to have some of those more statewide resources that people can access to be able to get those vaccines.
Right now, Wisconsin has yet to release this data, but in states that have, and a lot of the states that have, they've shown that so far, a lot more white people are getting vaccinated at a higher rate than blacks or other minority populations, despite the disproportionate toll that this pandemic has had on some of these minority populations. What steps do you think can be taken to make sure that vaccines in Wisconsin are distributed and administered in an equitable manner?
So I agree, and I think there are two problems with that. Number one is making sure that we are getting the vaccine where it needs to be, and that the vaccine that are in those communities stays in that communities, and so that we're not having people from outside coming in and taking those spots because they're better or faster at signing up for a computer system. I think that's happened in other states, and it is possibly happening here. So we want to make sure that that vaccine stays within those communities. Secondly, we as healthcare systems and healthcare providers and as prominent officials, we need to garner more trust within the system. And so we need to be able to meet communities where they are in terms of their trust for the healthcare system and trust with vaccines, and be able to show that this vaccine is safe and effective. And we've got some work to do in that area, especially within communities of color.
So you, Representative, you are new to the legislature, but what steps do you think can be taken to improve the relationship between the legislature and the governor?
You know, I think honoring agreements that have been set is absolutely the first step in the process. You know, the Senate and the governor came up with a compromise bill. And when it came to the assembly, that compromise bill was, thrown out and added additional poison pills that they knew that the governor would not sign. There are areas of agreement here between both Republicans and Democrats to be able to move this forward for COVID relief for the state of Wisconsin. We need to focus on that compromise bill that was already negotiated within the Senate. And I think that will go a long way to establishing trust to be able to work together moving forward.
Excellent. Senator Erpenbach, going back to the vaccine rollout question, what more do you think can be done to improve the rollout of the COVID-19 vaccine in Wisconsin?
Sara hit on pretty much everything. I want to go back to the beginning, though, because I know at that particular point in time when the vaccine rollout first happened, I mean, we're talking like the first week, each state was told a certain number of doses that they were going to get on like a Thursday, for example. And come Friday or Monday, we found out we were getting half or less than half. And that happened for about the first month. And I know that in dealing with the hospitals and making sure that the frontline workers in hospitals had vaccines, it got a little stressful there. And it was in part because it's the first week or the first couple of weeks and we're not getting what we were planning on getting. And that did slow things down. But, you know, fast forward to today, we're number one in the Midwest when it comes to the vaccine rollout. And I think how we can make the rollout even better is actually just more vaccines. I think the nuts and bolts are now in place. And the more vaccines we get, obviously, the quicker we can turn them around and get them into people's arms. We couldn't say that when this first happened because, again, you know, even following CDC guidelines, which is what the panel was doing and trying to figure out who was next up when it came to the vaccines, we just simply did not have enough. But now we're getting more and more each week. And as a result, obviously, more and more people are getting the shots in their arms, and the turnaround time is almost down to nothing now.
So you heard Senator Testin talk about his opposition to Medicaid expansion. Other Republicans have already, again, voiced similar opposition. What is, as you think about your health priorities, legislative health priorities, what are some priorities that you're focused on that you think really can gain some bipartisan approval this session?
Well, first of all, on the Medicaid expansion, I heard what Senator Testin had to say. I've heard what Republicans have been saying on this for years. They're out of excuses. They are simply out of excuses. Everything they said that was going to go wrong with Obamacare when it came to the Medicaid expansion, and the money's not going to be there, and the money's still there. And we continue to pass on hundreds of millions of dollars a year simply because they're stubborn. And the idea that we could really up reimbursement rates for the providers out there, we could expand access to people who are making, you know, $12 an hour, $10 an hour. That's not a bad thing. That's actually a really, really good thing. So they're out of excuses, and hopefully we'll continue to push for Medicaid expansion. That being said, mental health is a big issue, certainly in rural areas, and I've got rural parts of my district that are struggling with not only making sure that people have access to mental health, but making sure that there are providers who could provide that access to mental health. So mental health is a big deal. And I think part of the reason why it's much more of a pressing issue now than it was 10 or 20 years ago is we recognize mental health issues differently today than we did back then. You know, to me, mental health has always been like having a broken leg. If you have a broken leg, you have to get it fixed. We can all see that you need to have your leg fixed and then a cast. When somebody's dealing with a mental health issue, you see it in alcohol, you see it in drugs, you see it in gambling, you see it play out all sorts of different ways. And we used to say, wow, that person just has problems. Well, no, they're struggling with mental health issues. So now that we recognize that, we need to have an infrastructure in place in rural areas to make sure that providers are there and that they're there and that they have the capacity to take on the cases that are out there, because there are so many mental health issues out in rural Wisconsin. So that obviously is an important issue. If we can't push through recreational marijuana, I still think we need to take a look at medical marijuana. And you'd mentioned, Tim, a little bit earlier, excuse me, and I didn't address it, that you're right, the medical community as a whole isn't behind the idea of medical marijuana, in part, I think, because of the way it can be ingested and that it could possibly be a gateway drug to other worse things. That being said, I do know that there are individual doctors who told their patients that if this is what's going to get you through chemo, then go ahead. So while the community officially is opposed to it, I think doctors more and more are coming around to the idea of medical marijuana. Doctors individually.
What are other specific steps you think need to be taken to address COVID-19?
I can't stress this enough. Wear the damn mask. I mean, it's very clear based on what Pat and what Joe had to say. It's not about the governor overstepping his bounds. It's about the mask. And the idea that people, for some reason, a mask has become political and became political way back when the science tells us and the medical community tells us that lives are saved because people are wearing masks. We have another, I think the UK strain showed up in Wisconsin today. I think it's the second case that's been documented. There are new strains coming out on this stuff, which is more important why we really need to double down on the idea of wearing a mask. And it's not up to the courts. The courts aren't going to cure this pandemic. You can't fight this out in the court. You can't slow down so the Republicans in the legislature can get it together and figure out how to go through the rulemaking process. The pandemic is nimble, it's quick, and we need to be in a situation where we have leadership in Governor Evers and the others over at DHS to act quickly and not have to wait for the legislature to come back in and maybe take something up or maybe not take something up. So wearing a mask, obviously abiding by CDC guidelines, social distancing, and all of that right now. We can kind of see the light at the end of the tunnel here. Obviously, the more people get vaccinated, the more we get to that whole herd immunity thing, and the less the various strains will happen. That being said, until we get to that point here in Wisconsin, which we're a few months away from right now, that's why it's more important now than ever before that we continue to wear masks and that the governor continues to issue executive orders if the Republicans go to court or if the Republicans overturn his executive orders, because masks work. We all know that.
Senator, you've been in the legislature longer than Representative Rodriguez. Well, what steps do you think need to be taken to help improve the relationship between the governor and the legislative branch?
Recognize the fact that we, this sounds really simple, but we have so much more in common than we don't. I mean, I know Joe and Pat don't want people to get sick, but they are getting sick. And so if you don't like what the governor's doing, then I want to hear what you want to do. And I don't like the idea that, the speaker thinks he is a co-equal to the governor. He is not. He is the Speaker of the Assembly. We have a majority leader in the Senate. The idea is that we are supposed to work together. But like Pat said early on, the first action the Republicans did in the lame duck session was to curtail Tony Evers' powers and Josh Call's powers for that matter. That doesn't, get you off on the right foot by any means. So the governor, I know his door has always been open. He's offered up, I don't know how many times, to sit down with the leadership in both houses to work through COVID-19 and to work through other issues. But, it's not happening. And it's not happening because essentially the leadership in both houses have agreed, let's just, kind of wait out the next couple of years of Tony Evers' administration and we'll see what happens. But in the meantime, this pandemic comes along and it crashes Wisconsin to a halt. Schools closed, universities closed, businesses closed, businesses went out of business, people got sick, people died. And the Republicans didn't do anything for over 200 days on this issue. So the idea that how can relations be better when the governor's doors open, the governor makes calls, the governor invites them in to sit down and talk about this issue, and they don't. And they finally address it in the first week when we're back in session in January, and end up passing a bill that's going to get vetoed. So the speaker and the majority leader know how to get along with the governor. And it's really upon them because the governor can't open his door any wider than it already is right now.
Senator, we're going to have to end it on that. Thank you so much for your time today. Thank you, Representative Rodriguez. Thank you both to Senator Testin and Representative Sanfelippo, who had to sign off early. Thank you all for tuning in today. Thanks to our generous sponsors for helping make today's great discussion possible. We will see you again soon.